that's fascinating. Well, I know people have questions. If you got some extra time, we could
There's
go.
two right now. It says I mix smoothies in the morning and grind all of my supplements up in the mix. Yeah. So yeah, okay. So when we put the supplements and we put them like in capsules or we coat a tablet, it's because we're trying to protect the nutrients through the stomach cycle. Understand that the stomach's job is to destroy everything. It's called acid hydrolysis. It's like a sledgehammer to your nutrients, trying to break them down. Break down peptides to amino acids, proteins to amino acids, break down carbohydrates to simple sugars, break down lipids to simple fats. But it's a break it down, break it down, break it down. So when it gets in the intestinal tract, it's easier to absorb enzymatically. I don't have a problem with people opening the capsules and maybe putting in food. I'm not a big fan of mixing it, of blending it, of trying to crush it, and because I think you're going to wind up destroying some of the nutrients. So that would be my only thing. So mixing it up is not such a problem. I don't know about putting it in a blender. Okay. And then someone just says they love us. I love that. Okay. Love you too. Do the new have to be taken more in complete? That's a good question. So I didn't like the directions, take 3 in the morning. That was a Neil thing because compliance is always an issue. The more you tell someone to take something, the more split doses, the less they'll do it. So it's always better if you can tell someone take them all at once. But it is true with any of these nutritional products that spreading them out through the day is going to give better benefit. You're going to get better absorption. So if you took 1 3 times a day, that would actually be better than taking all 3 at once. And you certainly don't need to take it first thing in the morning. You take it anytime throughout the day. I said the press release made her dizzy. She's very healthy, 67. That's funny. Is she so the mother that says she feels drunk on the plus relief? Is she on any other medications? Because one of the things that the plus relief does is it makes all your other pain meds work better. So if she's on an opiate, she could have an effect where the opiate is making her feel like that. Plus, make sure she's drinking plenty of water because simply dehydration can make you feel like that. In fact, that's what leads to hangovers after drinking is dehydration. But certainly the plus relief can't cause that to happen. It certainly can't cause you to be drunk. So a friend with MS, any recommendation starting them with, been in wheelchair for 10 plus years. Yeah, I'd certainly get them on the plus relief. My guess is they're on some medication, whether they're on Avonex or one of the newer MS drugs or on immunosuppressives. But I'd highly recommend the plus relief. I recommend the Zimmunity, which is immunomodulatory, and of course the Cell Defender. Even the plus relief, normally taken for pain, does have some of that alpha toxin in it that's in our MS drug. And we've seen a lot of MS patients with deficits say they have some relief of deficits, especially chronic fatigue. And I think that's important. So if you ask the average MS patient what their biggest complaint is, and it could be someone in a wheelchair, it could be someone that's non-ambulatory, their biggest complaint always is chronic fatigue. They're like, Rick, if I could just keep my eyes open, I could handle this. And so what we've seen, even just with what's in the plus relief, is a relief of that chronic fatigue. So they start feeling better, they have more energy. And we've also seen that with the Cell Defender. So I'd highly recommend that stuff. And then we have the Mind Invision, which has neurotransmitters in it. So the Mind Invision might help as well. I always recommend DMAE for MS patients, dimethylaminoethanol, and that's actually one of the components of the plus Mind Invision. Okay, do any of your products help people with Parkinson's or diabetes? Well, that's a very broad question. Certainly, Cell Defender helps everybody with everything because a cleaner, healthier body fixes itself. Parkinson's is tricky because Parkinson's is a destruction of part of the brain, part of the substantia nigra. So the be-all, end-all hope of Parkinson's is going to be stem cell therapy. Can we have stem cells regrow that part of the brain? In the meantime, nerve signals are improved with the plus relief. In fact, that's something else I wanted to mention. Dave, you brought that up. But we talk about turning down the signal for pain. But remember, it's a modulator. So some signals actually get turned up. And my favorite story, I've told this before, is one of our longest term investors was in his late 60s. He had pain. He was taking what is plus relief for his back pain. And he calls me crying. He can't believe. I'm like, what's going on? He goes, I took your product. He said, oh, yeah, it's working, right? You're pain free. He goes, no, you don't understand. When I was 9 years old, I was hit in the face with a baseball. It shattered my orbital, shattered my cheek. I got a metal plate in my cheek. I had not felt my left cheek since I was 9 years old. I'm on your product now 3 weeks, and I got feeling back in my cheek that I never had before. So that was a happy side effect. And it's probably because those nerves were so over innervated that they basically shut down. And now by turning down that signal, those nerves now can start to function again and carry a signal. So that was kind of a very cool thing for him. So Parkinson we just talked about, but diabetes, obviously we have the cell defender, we have the fiber, and the fiber has been clinically proven to reduce HbA1c and lower postprandial hyperglycemia. So the fiber definitely should be used by diabetics. And we have distributors that have seen their HbA1cs come from as high as 14 and 15 down to 4 and 5, which is an average measure of your blood sugar over a 3-month period. And anything under 6, you're no longer diabetic. So we've seen that just with the use of the plus fiber. So anyone diabetic should be using the plus fiber. And then of course the plus relief, if you have diabetic neuropathy, will help with the neuropathy. And then we have now the new cardiovascular product, the Cardio Care. So that helps with circulation, helps move things around. Is there any synthetic venom? Person who's allergic to cobra should have a chance to take this product anyway. How do they know they're allergic to cobra venom? That's a really good question. Because if they got bit by a cobra, that's not an allergy. That's the venom doing what it's supposed to do. There are synthetic venoms. In fact, there's a product called Citizen, which is a topical that they equate to Botox. And just so you know, if you don't know what Botox is, it's botulism toxin, which is by weight the deadliest substance on the planet. Pound for pound, botulism toxin is the deadliest substance on the planet. 1 kilogram of botulism toxin in the New York City water supply would kill every man, woman, and child in the city of New York. And yet we inject it into our face. I've never understood this. So the same people that are scared to take plus relief because it's got cobra venom in it, oh, that's scary, have gone to the doctor to get Botox injected into their face. So that, to me, that's absolutely ridiculous. But no, in fact, the only way we can call this a homeopathic and sell the product is because we use natural cobra venom from actual cobras. It's not synthetic. Does the cardio product address high-level homocysteine? Yes and no. It has things that are anti-homocysteinic, but I also recommend a B complex. So if you have high homocysteine, the best way to lower homocysteine is with B vitamins. And we decided not to add those B vitamins to the Cardio Care because it's very cheap. For $5, you can go get a B supplement, take a nice B complex. So yes, if you have high homocysteine, I would recommend the Cardio Care. I'd also recommend a B supplement. Okay.
Just along on the Cardio Care, it seems like some is good, more might be better. So I'm taking 6 a day, and I do that 2 tablet or capsules 3 times a day.
That's fine. Yeah. It's just like with all of our products. The recommendation is for the general person. But if you know that you have existing heart disease, if you know you have existing vision problems or mind problems, then for those products, you can certainly double up the dose. That's fine. And I say the same thing with this immunity. If you know that you have an immune system issue, if you're now fighting a cold or fighting something, you can certainly double up on that. Let's see. What's this here thing? His MRI shows cloudiness in his lymph. How does the MRI show that? Yeah, so understand MRIs can only look at your blood. MRIs really don't look at your lymph. MRIs are magnetic. So the only thing magnetic in your body are the iron that's in your red blood cells. And so every time you get an MRI, you're really just visualizing where blood flow is, where circulation is. That's how an MRI works. So I don't know what it means by cloudiness in his lymph. That's a really weird thing to say. But if he's feeling well, then that tells you he's doing well. I don't know why he would stop the cell defender. Certainly the cell defender can't hurt. It can only help. You know what? You can only lead a horse to water. You can't make him drink. We've got really, really great stuff. And it's been heartbreaking to me when people just don't listen. So I don't know how close this person is, but I will tell you one story. We had an Australian distributor with my first product, and her father was an oncologist that was diagnosed with stage 3 lung cancer. And she tried to get him to use the product, and he refused. And he's an oncologist. So she said she's not taking no for an answer, and she just started putting it in his food and his drink and his water. Every time she had a chance, she dosed him. She would just put the drops in. And next thing you know, he's saying how great his chemo is working. He feels great. He's getting better. She never told him. She didn't need the credit. She just wanted her father to be healthy. This is the sort of thing where normally I wouldn't say dose somebody's drink, but this is not going to hurt them. So if you can get them the product, get them the product.
That lymphatic cloudiness or something, a personal experience. When I was going through the challenge, I was pretty anxious. I was following the Marcy dose. And so just 3 weeks into it, I went in and asked for an MRI. And my doctor called all concerned because she said those 5 lesions are substantially bigger than they were just 3 weeks earlier. And that scared me. So I called Chip and he said, "Oh, great. That's wonderful because you're winning. You're killing them. And the MRI is just showing the battlefield. And when things die, they swell up." And so I called my doctor back and explained that. And she says, "Oh, yeah, that sounds plausible." And so I just kept doing it. And yeah, so maybe
Obviously it was beneficial. Yeah. Yeah, but that's my point. My point is it cannot hurt. There's no mechanism at all that says it could cause damage. And I said, if it can hurt and it might help, why not try it?
Absolutely.
Yeah. So yeah, it's another tool in your toolbox. All right. So young dog diagnosed with severe arthritis, take the dose of pain plus pain daily for long term to help. Yeah. So this is something that's just like the plus relief. You can take it for chronic pain. You can take it long term. And I always talk about an older dog or cat, but certainly there are certain breeds that have arthritis. And this is something we do. This is all our fault because we breed dogs. We basically breed the dog to be that dog, and we breed all of the problems into them. So we know dogs like German Shepherds are always going to have hip problems. We know certain dogs are always going to have cardiovascular problems or kidney problems because we bred that into them. And that's why the healthiest dogs on the planet are mutts. You mix them up as much as possible and they're incredibly healthy and they'll live forever. But certainly you can use this all the time. There is no upper dose. Just like with the plus relief, you want to make sure they have access to water. So especially if you're giving them a high dose, just make sure they have water available so they don't dehydrate. They drink plenty of water. Hydration. Okay, so the plus hydration, they want to know if it can be mixed just with water, it can be mixed with other powders. And so it depends what your goal is. I mean, it is a nice mix of electrolytes and healthy carbs, but the purpose of the plus hydration, what makes it different is its osmolality. The osmolality is a measure of the solid particles in a liquid. If you mix it with anything else but water, that changes, and it changes the way it's taken up into the body. So the best way to use it is just mixed with water, and you drink it during physical activity when your muscles are carb starved. That is the absolute best way to take it. In that case, the electrolytes keep the water in the blood, and the carbs drive the water into the muscle, and the osmolality lets it to get out of the digestive tract into the bloodstream very, very quickly. That's how it works. Now, if you're taking it for any other reason, you just want some electrolytes and the carbs, yeah, you can mix it with anything, but then it just becomes a drink additive. It loses the science of the low osmolality. The other best way to take it is before bed. And I say this especially with older people that have muscle cramping at night, that have restless leg syndrome. All of that is due to dehydration and loss of glycogen. So if you take it just before bed, then you're going to absorb that water. You're going to get that water into the muscles, and it's going to reduce things like muscle cramping at night.
Useless thing would be add it to a shake. That would be get rid of the effect. But at night, I like adding it Calm, which is just a magnesium supplement. I think that does not affect the osmolality.
That would adding ionic minerals will not affect the osmolality at all. So that's a good idea. That's good. Yeah. Oh, you can't see the questions? They can't see the questions? The QA at the bottom of your screen, you should see a QA chat board.
Yeah, Q&A.
Yeah, so everyone has access to that. How long is the fiber effective? It says 10 to 15 minutes before meals, but I sort of snack over an hour as opposed to 2 large meals. Okay, so think of the fiber as food. It's like the healthiest bowl of cereal you ever ate. You can take the fiber at any time and it's going to be effective. It's going to be great. If you want the most effectiveness, you want to take it 10 to 15 minutes before you eat, specifically because as it forms this gel fiber matrix and then you start eating, your food is going to go into your stomach at the same time that gel fiber matrix is there. So that's going to help delay gastric emptying. It's going to trap the bile salts and bile acids that normally break down your food. All those great benefits for cholesterol reduction, for sugar reduction happen if you take it 10 to 15 minutes before a meal. I say, just pick your 2 largest meals and take it 10 to 15 minutes before then. But if you're more of a grazer, if you're eating smaller meals over time, then that's fine. Just pick 2 of them and take the fiber with those. How do you suggest use for period pain? So that's interesting because a lot of that also is dehydration. So make sure I actually recommend the plus hydration for menstrual pain or premenstrual pain, but certainly the plus relief can be used. So when you know that you're about to get your period, then you want to start taking it as you would for chronic pain. So 3 to 4 sprays, 3 to 4 times a day, and you're going to have a lot of benefit. We also did a study, now that you mentioned this, in vulvodynia. For those of you who don't know, vulvodynia is pain during sex for a woman. And it's not just physical pain, it's neuropathic pain. Basically, there's something wrong with the nerves where the women experience sex as instead of experience pleasure from the sexual act, they experience it as pain. And it's really just a backwards reading of the nerves. And so there's really no treatment for it. There's about 1 million American women that we know suffer from vulvodynia. And we did a small study where if they took what is the plus relief before, that actually regulated, that went away. So it's something I'd really love to do a clinical study on, because it's something that I think is just untreatable, and we have an option for that. Let's see. So yeah, someone just saying connect with Michael J. Fox. We actually reached out, but like I said, we don't really affect Parkinson's. The big be all end all Parkinson's is going to be stem cell research, which is what the Michael J. Fox Society is actually doing. So at some point, the stem cells are going to be the answer for everything. We're going to be able to regrow organs, regrow limbs. Just because we have pluripotential stem cells that can become anything. Rick, mental tell you, son, you look so much slimmer. Your face in the Zoom is, oh, thank you. I did lose a little bit of weight. I didn't hit my goals, and I've just been so busy. My wife goes to the gym 4 days a week. Every time she goes to the gym, she wants me to go with her, and I just don't do it. I'm just too busy, and sometimes a little lazy, because I try to get my rest when I can. But thank you very much. I do really want to do body transformation contest again, but do it right. I think when we launched Trim Science, we didn't do it right. So I'm working with Neil to do like a really good body transformation contest with the Trim Science bundle. I don't know if we'll do it this year, if it's going to be maybe early next year, but I kind of want to gear up for that and get the diet right, the exercise right, and the products right. Let's see. Client asks how to clean out fat tissue. And then someone says, I saw this a question before on WhatsApp. Someone who has hemorrhoids is afraid to take the cell defender. That makes absolutely no sense. Why would she be? The only thing you're afraid of with hemorrhoids is either the stool being too hard or too soft, you know? So I don't know why she'd be afraid to take the cell defender. That makes no sense. And then someone had said to clean out fat tissue. I'm assuming you mean of metals. We talk about this all the time. When you take the cell defender, it cleans out everything. It cleans out all the blood, all the lymph. And once all that is empty, once you have all that heavy metal and volatile organic compounds out of circulation, your tissue will start to release it into circulation. It's called Le Chatelier's principle. It's balance, homeostasis. That blood and lymph now empty of those toxins creates a concentration vacuum. And it's a concentration gradient where the tissue will then start to release those toxins out. And that's why you want to keep taking the cell defender, keep taking it, because your entire life you've been holding on to these toxins. B complexes should be methylated, right? No, there's lots of great B complexes. Everyone tries to say theirs is the better, if it's a methylated cyanocobalamin or not. But I would warn you, don't take just a single B vitamin. I'm not a fan of just B12 or just B9. Some people just take folic acid or just take cyanocobalamin. B vitamins are really meant to be taken together. They work in tangent in concert with each other. So I would find a good B complex that has all the B vitamins in it, and you can just take that once a day, and that'll be incredibly effective. Let's see. We were at a conference, heard Ace's mom. Great niece has aggressive bad cells, 17 months. How much cell defender is the immunity for a toddler? Well, it really depends on the toddler and what the parents are willing to do. Obviously, a toddler is not going to be swallowing capsules as immunity. So you can open them up, and probably 2 a day is immunity if you can open up and put it in their food. And then cell defender, 5 drops 4 or 5 times a day is plenty for a toddler. But the whole idea is just get them taking it, and every time you think there's no upper dose, there's no amount that's going to hurt them. So the whole idea is just to try to get at least 2 to 3 to 5 drops at least 4 times a day. All right. The brain Invision assist hearing. I don't know. It really depends on what the cause is of the hearing loss, but it's a really good question, something I'd like to look into. Understand that when I first started talking to Neil about new products for a conference, we talked about a product for vision, we talked about a product for cognitive function, we talked about cardiovascular. And it was only because I attended a seminar that Kemen put on where it really opened my eyes to the fact that the brain and the eyes are so intimately connected, and that anything that's good for the eyes is good for the brain. Anything that's good for the brain is good for the eyes. And that led to the Plus Mind Invision. And I got to tell you, Kemen, that makes the Floorglow lutein, they thought it was the best product they've ever seen. And they've had Floorglow lutein now for almost 30 years. They have not seen this combination where we're focused on mind and vision. And it's both. And they love the formula. They love working with us. They want to do some clinicals with us with it. But it is interesting. If the issue with hearing is neurologic, then yes, the Plus Mind and Vision will probably help improve that hearing over time. But it is something that I'd like to look at. How often you take the fiber? Fiber is food. The Plus Fiber is food. You can take as much as you want. Our clinical research tells you to take it twice a day before your biggest meals. That's the best way to take it to get the results we've seen in our clinical studies. But you can take as much as you want. It's just healthy fiber. Does the Plus Hydration continue to work as you drink more water? Does it need to be added to every 6 to 8 ounces of water? Okay, so there's a misnomer. This is not, you're not replacing water with the Plus Hydration. What's happening is the electrolytes in the Plus Hydration will allow your body to hold on to more water, and the carbs in Plus Hydration will drive that water into muscle. If you take that Plus Hydration, then you drink additional water, you're getting the benefit of the Plus Hydration. Okay, so it's just like you don't replace every drink with Gatorade. You have that one Gatorade, and then you can drink water. I hate to use that as an example because those sports drinks have a lot of issues with them that the Plus Hydration does not, but that's basically how it works. It's safe to give pets the Plus Fiber plus cardio care. Certainly the fiber is fine for pets. I don't know about the cardio care. There could be ingredients in there that aren't safe for pets, so I would hold off. If you have a pet with cardiovascular disease, then we could talk about it. We talk about what I would recommend for that pet. But certainly the Plus Fiber is just food. Yeah, guys, if you can't see the questions at the bottom of your screen, it says Q&A. Just click that box and you'll get the same box that I see. I don't have special powers. Okay. So it's a box, and that's how people are even asking the questions.
Looks like everybody else is doing it. So
okay, then someone says, can you use the Plus Fiber as a smoothie? Yes, you can use the Plus Fiber as a smoothie. My wife mixes her protein powder in it every morning. That's like her breakfast is a Plus Fiber and protein powder. But like I said,
body too.
What's that?
Gives it a little bit more body. I like it shake.
Yeah. So certainly you can do it, but like I said, if your focus with the fiber is to regulate blood sugar and lower cholesterol, the best time to take is 10 to 15 minutes before a meal. Okay. Cell Defender for herpes. Well, Cell Defender for everything. Remember, herpes is an infection, so I'd really stick with the Nano Silver. But if you're taking the Cell Defender, then if you have herpes, you definitely should be on the Nano Silver. The best way to think about it is the Cell Defender takes out everything that's not living in your body that doesn't belong there. Okay, the heavy metals, the volatile organic compounds. The silver takes care of all the living stuff that doesn't belong in your body. The bacteria, the viruses, the protists, the molds, that's taken care of by the Nano Silver. So together, it's really a nice 1-2 punch, getting things out of your body that don't belong there. Is Hydration Plus helpful for migraines? It can be. Let's talk about that for a minute, okay? The number one cause of headaches is dehydration. That's the number one cause of headaches. And so a lot of people that get headaches all the time, they're probably chronically dehydrated. Migraines are different. A migraine is differentiated from a headache because of something called spasmolysis. It's spasming of the blood vessels. It's very different. So I hate it when someone calls me and says they have migraines, and it's clearly not a migraine. It's just a bad headache. It could be a tension headache or a cluster headache. It is not a migraine. Migraines are very specific, where you have spasming of the blood vessels that go into the brain. And as those blood vessels spasm, they cause all the things that are hallmarks of a migraine: the aura, the light sensitivity and sound sensitivity, the nausea. That's all very different than a regular headache. Okay. So there's lots of things that can prevent migraines. We've actually seen great results with Plus Relief. If someone is a migraineur, which means they have at least 2 to 3 migraines a month, I would recommend using the Plus Relief oral spray. Taking that daily, we found has actually prevented migraines. If you have a migraine attack, in the middle of a migraine attack, use a Plus Relief gel, a little rubbing on the temples and on the back of the neck, and the migraine goes away very quickly because it relaxes everything. It takes away that inflammation and the spasming stops. And that's the way to stop a migraine quickly. Certainly Hydration Plus is great to keep hydrated, and so reducing risk for all headaches, including migraines. Because also remember that migraines have a trigger. So if you are a migraineur, keep a journal. Everything you eat, everything you drink, your activities, because you're going to start seeing a pattern that you do certain things, eat or drink certain things, and that leads to a migraine headache. And that teaches you what to avoid, what your triggers are, and things you can avoid to avoid even getting a migraine to begin with. How is this with severe pain and multiple myeloma where her bones are crumbling? Yes. So I talked about 47 published human clinical studies. 22 of those are in cancer pain or in cancer patients. Because like I said, not a lot of stuff can touch that visceral pain, that deep pain, but the plus relief can. The plus relief works with that. I actually work with an oncologist in Boca Raton, Dr. Mitch Genn. He actually has a website and he has a TV show, Ask Dr. Mitch. It's every Friday afternoon. So and I think Dave, you had posted, I did an interview with him. I think you had posted it to WhatsApp. Yeah. Yeah. So I'm like, how'd you find this? It was funny. But he uses the cobra venom in all of his cancer patients to deal with pain. And I've actually walked into his infusion room where he's got about 20 infusion chairs and the cancer patients. And he said, this is the cobra venom guy, Rick, with the pain reliever. And I got everyone who could stand stood. I got a standing ovation. Other people just clapped in their chairs because this is the first thing that they've been able to take for cancer pain that actually worked. So absolutely. Let's see, I don't eat until about 2 usually. I've been taking the plus fiber and don't eat. Is that a problem? No, like I said, I'm going to say this one more time. Plus fiber is like the healthiest bowl of cereal you ever had. It's a great, great, great food product. It's got oat fiber and carrot fiber and apple fiber. It's great. If you want the additional benefits of fiber, so just taking it like that, it's going to help with digestive motility. It's very healthy. But if you want it to lower your cholesterol, you want it to stabilize blood sugar levels, you want all those extra benefits, the best time to take it is 10 to 15 minutes before meals. Okay. But otherwise, you can take it anytime you want, and it's healthy fiber. My daughter has type 1 diabetes. She takes fiber plus fiber in the morning and night. And will she have low or blood sugar? Well, no. Okay. So type 1 diabetes is a little different. Type 1 diabetes is autoimmune, and they're always insulin dependent. But certainly she can take it before meals and she'll have the same benefit, lowering postprandial hyperglycemia and lowering HbA1c. It's not going to drop her blood sugar. It stabilizes blood sugar because your food gets absorbed more slowly over a longer period of time. Please advise if plus mind Invision is okay for someone with diabetes and one kidney. Yes, there's no issues if someone has diabetes and one kidney. I was able to catch some of this presentation, but company came and I missed lots. Will this be posted rewatch? Dave, I don't know what you do. Do you post these?
Oh, sure.
Okay, that's a yes. I brought up some studies on Parkinson's relating to metal toxicity. Of course, pesticides. Should cell defender help if that is the cause? Okay, so again, yes. I truly believe that there's two types of Parkinson's disease, early onset and senile Parkinson's. And I've had personal experience with people that had early onset Parkinson's, which I think is directly related to heavy metal toxicity. I knew a guy, Dr. Donald Baird at FAU, that had Parkinson's in his 40s. He worked with osmium compounds in his lab. And I'm convinced those osmium compounds caused the brain damage that led to Parkinson's. The problem is once you have Parkinson's, you already have damage to the substantia nigra in the brain. And nothing we know how to do will repair that damage. Okay, that's damage to a part of the brain that doesn't necessarily heal. So yes, the cell defender will remove toxins and heavy metals, will reduce the risk of developing Parkinson's if it's caused by heavy metals. But once they have the Parkinson's, it's not going to reverse that. In that case, like I said, I think the plus relief helps a little. I think the plus mind Invision will help a little. But the be all end all for Parkinson's is always going to be that stem cell research. How do we rebuild a part of the brain? Okay, someone says lack of energy using all of the products. So I don't know how you're using the products, Gordon. You should talk to your upline who introduced you to it. Make sure you're using the products correctly, because even just with Cell Defender, every one of our 15 clinical studies, the participants said they had more energy during the day and they were sleeping better at night, just with Cell Defender. And then we have other products like the Trim Science, which provides energy, the energy shots, which provide energy, and adaptogenic herbs. We have lots and lots and lots of things to give you energy. So if you have a lack of energy, we have to look at how you're using the products, if you're using them correctly, and what else you're doing in your life. Does Cell Defender eliminate forever chemicals and the microplastics in drinks? So I've actually answered this several times. It is really, really, really scary what's going on out there and how many microplastics find their way into our body. They are transformed through liver transformation. So microplastics do have a mechanism for removal from the body through the liver. They are not removed by the cell defender, but we have seen over and over and over and over again that the cell defender improves liver function. We've seen liver enzymes come down, and we've seen transformation mechanisms improved, especially glucuronidation. And taking the cell defender by removing toxins that the liver normally would have to deal with allows the liver to do more work. So as a side product, as a downstream implication to a cleaner, healthier body, the cell defender will allow you to remove those forever chemicals and microplastics. Let's see. I'm asking about the plus relief. I'm new as of this week and trying to get a family member to start with cell defender. Okay, but what are you asking? I was told not to take any vitamins with any B vitamins with cancer. Okay, so I get a little annoyed because doctors always say you don't want to feed the cancer. It's a little confusing to me. Obviously, cancer cells are voracious. Everything you eat, everything you drink, all the supplements you take are eventually going to feed the cancer, but you still need to stay healthy and you need to feed the healthy cells, especially the immune cells are going to help defeat the cancer. And that's another that's another thing that's counterintuitive is that chemotherapy destroys your immune system. So you're taking chemotherapy to destroy the cancer, but you're also destroying the immune system. And it would be nice to have an immune system to try to clean up the cancer. So there's a lot of misnomers there. I've never heard no B vitamins with cancer. I have heard, and this is funny, beta carotene with cancer. And that's because there was one study published about 25 years ago that showed that smokers that took high doses of beta carotene had increased risk for developing lung cancer. And I'll tell you why, because any antioxidant, if you take it by itself, can become a pro-oxidant. It can actually become oxidative by itself. That's why you never take an antioxidant by itself. You take antioxidants together and they work in a melee effect, so they recharge each other. Okay, if anyone wants more information on that, the best thing to do is go to the Les Packer wrote a book called The Antioxidant Miracle. Great book. It's online. Really tells you how antioxidants work in the body, how they work together, how they should be taken. And he actually created the Packer Institute at Berkeley, which does all this antioxidant research and reduction of pro-radical oxidation and oxidative stress and disease. But the beta carotene thing, I couldn't believe it. So they said if you take high dose beta carotene, increases your risk for lung cancer. And they told doctors to advise their smoking patients not to take supplements that contain beta carotene. So I advised them. I wrote to the American Medical Association. I said, as long as you're advising your smoking patients, why did you advise them not to smoke? That would be a lot better for them than denying them vitamins that could actually help them. So if you're going to give advice, the first advice would be stop smoking. Okay, then you can work about what vitamins you can take.
There might be kind of an analogy with what you're talking about, the B vitamins. You don't want to take just an individual high power singular B vitamin and carotenoids. There's a lot more than just beta. There's a bunch of them. And
yeah,
so eating a carrot versus a vitamin pill that only has beta carotene is a big difference. And
exactly. All right, I'll do a few more. It's getting late. So Bill Spence asks for plus relief. Why do people have to take for 5 days to start? What's the reason? I actually talked about that. When you take the oral spray, it gets into the receptor. The receptor has to change shape to accept it. And that is something your receptors have to learn. So some people take the oral spray and they see benefit right away. But for most people, it does take about 5 days. 5 days of continued use, you feel better and better and better and better as those receptors get used to that conformational change and start accepting the product. You grow more sensitive to it, and you're going to be able to lower the dose after that. So as you feel better, you'll be able to lower the dose. Now with the topical gel usually works within 20 minutes. So it's a really great product to give to people to create belief. I've actually done meetings where I've passed out samples at the beginning of the meeting. I started talking about 20 to 30 minutes in. I said, by the way, by show of hands, how many people tried the product at the beginning of the meeting? Mm-hmm. And you see them like going like this, they're moving their wrists, they start moving their elbows, they stand up and start doing, and it becomes almost like a church revival meeting. They're like, hallelujah. They can't believe that they felt so much better because there's no heat, no cold, no smell. It's unlike every other topical analgesic they've ever used. So they put it on and within a half hour, they forgot they used it. Because it just gets absorbed. And then they start feeling like, oh my God, it really worked. It worked for pain and inflammation. So the topical gel works great. It does work usually within 20 minutes and lasts about 4 to 6 hours. And just like with the oral spray, over time, you'll need less and less to get the same benefit. All right. I know there's a lot more questions, but we've gone an hour and 15 minutes, Dave. So I don't know if I can call it.
That's fantastic. I guess we could have an intermission and come back for another hour, but so much for your time and your knowledge. Wow.
No, this is my pleasure. We should probably just do Q&A nights. But I will say, I did start glancing. A lot of these questions have been answered already. So please go to Avini Health Training. Rich Cotter does a great job of keeping like all of the lectures, all of the Zooms, all of the FAQs. So a lot of the stuff has already been answered. You should be able to find it there. And certainly, if you want to do a deep dive for most of the products, I've done master classes. I did an hour master class on Plus Relief, an hour master class on Cell Defender, an hour master class on Immunity. So there's a lot of stuff out there that if you have the time and you want to do a deep dive, the content is already there.
All right. Well, thank you. Appreciate your time.
Guys, thank you. It's always a pleasure. Have a great rest of your weekend. And I think Neil has me on a couple other big things this week. So keep looking for the announcements. Also, the Avini Vision Tour. If you're anywhere near any of these meetings, get to one of these meetings. It's going to be really, really good. I think the first one is Idaho Falls, right? Yeah, so we're doing Idaho Falls, Portland, Oregon. We're going to be in Boca Raton in November. And anyone that makes it to the Boca Raton meeting, we're going to do tours of our facilities. You're going to see our new 18,000 square foot facility, our manufacturing. And then at some point, I don't know, we're not going to do it for this one, but at some point in the future, we're going to do trips where it includes a tour of the snake farm. So you guys can actually go down and pet the cobras. You know, not pet the cobras, but meet the cobras.
The spray is good enough for me.
All right, guys. Thank you so much. Bye.